It's because of
Whoever iPhone 7.
Clearly not welcome.
I think
We
we
all
just,
the
you know, we
goings
should
on
probably just do a roll call attendance.
You were still like
So we know who's here.
Okay.
hotel,
Yeah, it's BT, GMT, exclamation.
.go. Or like. Thank you.
Well, Glenn Filter, Emery Cross, PJ.
This is really speculation, but it was a targeted communities with Republican leadership. Oh, no doubt in my mind. You think so? You saw my guy, right? He's been on every talk show that'll have him. I know. It just is hard to believe in. I mean, just right or wrong, it's just doesn't seem to land there. I don't know.
Yeah.
My brother-in-law is the mayor of Amsterdam. And so immediately called our superintendent to make sure, the Amsterdam
yeah,
superintendent to make sure that that wasn't gonna happen there.
I have the sign sheet, I stole it.
And what letters, are there any caps?
Yeah, capital, the first letter is capital V, capital W, capital T, capital.
As we're polling for attendance, who's iPhone 7?
Contracted them out. For the.
I mean, just the first letter.
Say again?
I am.
Got it?
I'm not all there.
Well, I'm trying it.
I'm there. I'm here, but I'm not all.
Yeah, man, thank you.
And then the stuff out for the in that they feel is.
In fact, there's not even hotel staff. Yeah.
Going back to those stuff.
There's another layer in there. There's another layer in there. There's another company under .go, and I don't know what they're calling themselves, but that's there. Probably, yeah, private security.
iPhone 7 is Jeremiah Rod. Thought I fixed that, but apparently I didn't. So
Oh, you're good. Thank you. Yeah, it's up to you. Is there anybody I have a call? We jump in anything.
I think we got a quorum, yeah.
Okay. All right, well, Carol informs me that between the people physically in attendance and those online, we have a quorum, so we'll call a meeting to order at 6:05 p.m. Oh,
Yep,
is it?
recording.
Yep. And begin with the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of
America,
Republic.
to the republic for which it stands, one nation, under God, indivisible, liberty and justice for all.
Previous meeting minutes are recording, so we don't need to approve them. Excuse this evening are Kathy Allen, Rich Salucci, Jim Vina, Dennis Wood. Anybody else on there that I didn't mention? Okay. You're up. Executive Director's Report, Tim.
Okay, quick training update. All three courses are in progress, SUNY Albany, Skidmore College and Glens Falls. That's being held at the fire department up there. We're starting to plan a summer session now. Expect an announcement probably in the next couple of weeks or so, somewhere around there. It was a busy meeting month. It was the state meetings. Prior to that, we had the program director meeting, and one interesting note from there is Director Greenberg addressed the group and said that they may be pursuing some additional funding for the program agencies. Not sure how much, not sure if it would be the same across the board or if they break it down agency by agency, but we'll see what happens with that. And he also stated the Remsco funding is going to stay flat for everybody. Went to Aram's Remsco, not much to report out there. I just gave a brief report of what we've been doing there for them, the BLS modalities, the credentialing, the agency upgrades, etc. And I participated in their REMAX Zoom meeting. One positive note there, they pulled in a couple extra docs, so they doubled their roster from tip should be included.
Oh, it's already.
Yeah.
Oh, okay.
So lost my track. They doubled their docs from 2 to 4, so that's good news. Contract news. We're advised by the state that we are going to get some money from one of the old Aram's contracts, $30,000. There's a question mark about 3,000 or 4,000 extra there. We had to dot a couple I's and cross a couple T's. Hopefully we'll realize that money as well. And I just got word today that we should be seeing something from the BMO program agency fourth quarter from last year. So when it rains, it pours, hopefully. I'll believe it when the check hits the door, but it looks like we should be realizing some money soon. That concludes my report. If anybody has any questions, I'll be happy to take.
Seeing none, nothing under a chairperson's report. Any issue discussion somebody would like to bring up? If not, operational reports, Dr. Dan.
We did not have a REMAC meeting because of the state meetings. Next REMAC meeting will actually be next week. We're looking forward to. It's been a little while. The one thing we still do have a problem with in terms of the REMAC meeting is cookies. We're still looking to fill Sarah's seat. So if anybody chooses to bake, that would be greatly appreciated. In terms of news from a medical director's perspective, I think I don't have to tell anybody here that the hospitals continue to have a significant amount of challenges with orders and wait times. I bring apologies from the hospitals. The one thing I would ask everybody to go back and make sure to reinforce with your agencies is if a hospital asks you to go to triage, go to triage. That is going to be your first and most optimal opportunity to see a physician. The physician can then make a determination in terms of what the best destination for that patient is going to be. Yes, please continue to advocate for your patient, but we are significantly constrained by volume, including borders, and the physicians that we have in triage will be able to affect whatever needs to occur to get that patient moved as quickly as possible. We have had a couple of cases over the course of the last week where complaints were filed because a patient that we asked to go to triage continued to sit in the vestibule at the med until eventually they went to triage, where they were immediately removed from their ambulance stretcher and the crew was put back in service. So please, this is the way we will operationalize our hospitals. And we will, once that patient is there, do everything we can to take care of them as well as we possibly can. I'll throw in QI at the same time. The one important thing about QI that's great is we closed out CARES for the year for last year. Hopefully at our next meeting, I will have some reports for you. So how we did with that. It was a significant challenge in the end to make sure that we had all our agencies represented. We still have 1 or 2 holes, but we were the first region in the state to be a part of CARES. And it's pretty important for this region itself to continue to participate as completely as possible. because it is a very important quality metric, and it is now a statewide initiative that we had started. And actually, this group started, because this was a council-led initiative, as you will remember. We got it started. Let that right now.
Excellent. Any questions for Dr. Daly? Seeing none, Dr. McHugh.
Really not much to add because as already stated, we didn't have a REMAC meeting this month. We will next week. We're off cycle a little bit.
Very good. Thank you. Treasurers, PJ?
Okay, pretty unremarkable report. However, it's kind of healthy in a way, but most of the health is in the accounts receivable. And the good news is, you just heard from Tim, is that hopefully the state is starting to release some of those receivables. So receivables should turn into cash, and that's nothing but a good sign. In addition to that, our training revenue has been healthy this year. It's a matter of timing for cash balances. But basically they brought in about $44,000, which has been very healthy for the balance sheet. That's it.
That's good. Any questions from PJ? Excellent. CON committee was actually quite busy since we last met, and that'll all come up later on with some actions. And I'll just leave it at that. Information sharing, there are several. I'll read those into the record. Leah Cozino, Staten Island, New York State EMT number 361718, had their certification suspended for 1 year effective 1/11/24. That suspension was stayed. They were placed on probation for 3 years effective 1/11/24, and they were assessed a civil penalty of $2,000, 1,000 of which was stayed, for violations of Part 800.15B. Stephanie Lugo, Bronx, New York State EMT number 408-783, had her certification revoked effective 8/17/22 for violations of Part 800.16A. This notice was dated 1/23/24. And the Stanford Fire Company number 1 Incorporated from Stanfordville, New York, agency code 1330, surrendered their certification effective 1/9/24 for violations of Article 30, Section 30121F. Courses, informational guild EMS has an EMT original starting on 3/28/24. Correspondence. The executive committee did not meet. Finance, Steve Kroll.
No report from finance.
Very good. Anything new from New York State EMS Council?
Yes, the EMS Council's last meeting, give you a quick report. The new collaborative protocol for hospice patients was approved, so that'll be forthcoming. A lot of work's been done on improving the turnaround of reciprocity. The Bureau of EMS indicates that we're now down from a 3-month waiting time for an out-of-state EMT to get the New York State card to a couple of weeks. The Vital Signs Conference is going to be in Rochester this year, October 16th through 20th. They've added 2 new tracks for the educational programs, one's being special operations and one being rescue, trying to diversify the programming to see if we can get more people involved. The EMS Memorial has been set for Wednesday, May 22nd here on Empire State Plaza. Our region has traditionally been asked to turn out as many ambulances as we can since we're closest. The new EMS Memorial is supposed to be unveiled on that day. The memorial was full, so they, working collaboratively with a committee of interested members from the field, they designed new parts to the memorial, so they should be in place and ready to be viewed by people on May 22nd. The State EMS Council has formed a community paramedicine advisory group to develop and implement regulations for community paramedicine. Mark Spezio is somebody who you may know, who comes from Cambridge, New York, so he's not quite in our region, but they do lean into some calls in Saratoga and Rensselaer counties. Cambridge Valley EMS is one of the co-chairs. So I'm sure Mark will be interested in any comments anybody has about community paramedicine. The comment period on new education regulations is now officially closed. So now that the Bureau of EMS, the Department of Health will review those comments. If the comments are insubstantial, don't require another draft, they'll try and get the final regulations published. Among the things in that regulation will be the 3 to 4 year certification period. So once that regulation goes to effect, certifications and recertification will run 4 years, not 3. There's a separate set of regulations on ambulance equipment. That is a work of the Safety Committee of the State EMS Council that is now about to go open for comments. And this was designed to be less prescriptive in what equipment people will carry, even though I know at least one person in this room who has read that told me it was horseshit. But you have the chance to comment on it, and the NEMSIS updates have been implemented, and the state has taken us from 900 required rules down to 350. So for people that are working on charts that are being done, through electronic platforms, there should be fewer mandatory stuff. You hit fewer red lines that stop you from moving forward. I've noticed certainly a difference in my charts. The CMAC has voted and the Remsco has endorsed that EMT critical care will sunset on July 1st, 2027. I don't know that it affects many folks in our region. I think it does in some other regions, but with that sunset, anyone who is certified at the critical care level on that day will automatically revert to being a EMT level. People have until that day to take a bridge from EMT CC to paramedic. And so I think that long-running discussion seems to be concluded. There is something I don't know much about, but maybe Dr. Daly will know more about it than me. I know that the discussion of the credentialing policy between states and Remscos continues. There's a tag gathering information right now on what each of the regions is doing. And the short summary of this is the state believes that the ability of Remscos to regulate or to credential paramedics is quite limited. And the Remscos do not believe that. And there's a debate over how that's going to work out. Mike, you might know more than I do. You might not want to speak about it, but
This has been an ongoing issue. It's just gonna wait until the DLA has declared what the answer is and whether, the Division of Legal Affairs is gonna make this decision. And the regions will just have to live with that result. So regions that have had strong credentialing programs for a long time, or places I think of New York City in particular, with their REMAC test being, finalizing with a sit down in front of a doc and talk your way through it. I don't know what they're going to do, but they just realized they were going to lose that opportunity and they're getting up in arms over it. So just sit and see what comes of it.
okay, thanks, Mike. A lot of discussion about educational spending. The course sponsors are massively underspending the amount of money that we have in the New York State budget for EMS training. And so we keep asking for more money. And the governor's office basically looks at what we're spending and saying, but you're not spending what you have. There's a real push on getting course sponsors to sponsor classes and then voucher for funds. I don't think our region is one of the places where this is happening. I mean, I know that, whenever there's a opportunity for a course to happen, like the academy style classes, we always offer one. And so, but there's a really big, there's a big debate about the EMS training shortage. One of the things that we are pushing for is more money invested in CIC training, because it seems to be a little bit of a circle when there are people that want to teach courses, but they can't afford to pay the CICs. Therefore, CICs are retiring, there are fewer CICs. So we're really pushing the state to invest in CIC training. Many of you may know that the state is going to be implementing their EMS task force that is actually going to be hiring paramedics, and there was a little bit of an outcry from the field. There's a shortage of paramedics, and you're hiring 80 paramedics that have worked for the state. The director of the Bureau has agreed to provide scholarship funding for every paramedic the state hires. They will provide scholarship funding for the training of a paramedic. So the idea here is find new ways to spend money. And so there'll be a scholarship program not yet defined that will pay for the pay for 80 paramedics in the next year or so to go to school. I'm pushing for more than that, and so is my counterpart on the education committee. Performance standards, the the state budget last year, so not the one being considered now, last year put in place that there shall be EMS performance standards and gave the state EMS council the job of determining what those performance standards will be. That's been worked on for quite some time. They are now being narrowed down to 4 different ones, one on staffing and response, one on agency education plans, one on safety, and one on quality. At the next meeting in May, they're going to choose 2 that will be implemented in the next year. And so 2 the first year, then go back, look at others. I would be willing to bet that reporting on staffing and responses, in other words, everyone having to report their staffing and whether or not they respond to their calls will be one of them. And that there'll be a quality one as well. And my guess is that the education plan and safety will come in the next year. The most dominant thing that's happening at discussed at State EMS Council is what's happening in the state budget. There's a lot of EMS reforms. I talked about some of them at the meeting here last month. The director of Bureau has been doing webinars. I think everyone here was invited to one that was done specifically for the Remscos. I'm not going to go through all the stuff that is in there. I will tell you that if you want a summary of what's in there, if you go to the New York State Volunteer Ambulance and Rescue Association website, there is a side-by-side that's been endorsed by both the United New York Ambulance Network and NYSVERA. We did it jointly on there that shows everything that's in there, matches it up with the competing legislative bills, and then puts in there the opinion of NYSVERA and Onion, and NYSVERA and Onion have developed a joint set of opinions. So we're side by side. We don't have different. Our recommendations in each of those areas are the same. That's on the NYSVERA website. It's not behind the paywall. You can grab it. The biggest thing that we are advocating for that's not in the budget is a continued increase in Medicaid funding. And I have a 1-pager on this, and Tim, I'd like to send that to you and maybe you can circulate it to everybody. We are still paid far below costs for the Medicaid service that we provide. Not unlike the hospital industry, we've been lobbying to get continued Medicaid increases. The hospitals call it closing the Medicaid payment gap, and indeed they're running television commercials. You probably see them being run by 1199 SEIU. We're advocating for them to bring the Medicaid rate up to the Medicare rate. And so we're pushing for that to be done over 3 years. We have some members of the legislature that are interested in it. We're asking everyone to contact their legislators and push it forward. NYSVERA is going to be sending, and Onion are sending out an alert. I'm going to send it to Tim just so Tim can circulate it to everybody in our region. That's one of the things that is most undone by the budget. Or not done in the budget, but most advocacy groups in healthcare are disappointed that there wasn't new spending and rates this year. So that's what's happening at CMAC and Remsco, meeting coming up in May. By the May meeting, we'll know what happened in the state budget, and we can brief you on all that. Thanks. I'll answer any questions anyone's got.
Any questions for Steve? Nurses, Anne Marie Cross.
No report.
That was easy. MCI, BJ Keeler.
Same thing, no report.
Ms. Anybody regarding membership? No. Nominating? No report. Excellent. Awards? Sure.
Awards. So we're heading into award season again. I'm gonna have Tim send out the information to all agencies. But I really need folks to kind of get out into your, regions and get more people to nominate folks for some awards so we can have some robust choices
Activity
here.
before the
Yes,
11th hour.
Before the 11th hour, and we don't have to keep extending it. So the way we do it is we have the entire council vote since it's our award that we're giving. So what we'll do is we'll take all the applications in, we vet them to make sure that they meet the criteria for the award, and then we'll send out a survey to everyone to vote on who they think would be the best choices for the council to forward to the state. So we'll be starting that process very soon.
Sounds good. Any questions for Carol? No. County reports, Albany County. Maybe Charles.
Yeah, good evening. Just a couple points. Albany County has released a request for proposals for ideas regarding opioid settlement monies. And secondly, the Albany County Department of Health and Albany County Department of Mental Health met with the Albany County Coroner's Office to encourage them to submit fatality toxicology reports on a more regular basis, to also come up with a probable cause for overdose definition and submit demographics in that regard. And of interest, perhaps to Dr. Daly, expressed interest in establishing a fatality review process to look at overdose and suicide fatalities. That concludes my comments.
Sounds good. Any questions for Charles? Columbia County? Nothing to report. Excellent. Greene County? Steve's on there.
Nothing to report.
That was Steve Neer. Rensselaer County? Seeing none. Saratoga County? Tracy's there.
Nothing to report.
And that was Tracy Weir. Schenectady County, Jim Vina is excused.
Alex is in.
Okay. Or Alex or Dale.
Nothing to report.
Sounds good. New business are all related to CON votes. And we'll do the simplest first. So as you know from the information that Tim sent around to everybody, we made a clerical error as it related to the town of Ashland vote that we had at the last meeting. And the error that was made is that we forgot to actually reach out to the Department of Health and request a fitness and competency review for that vote. So the re-vote that we're going to take tonight is affirming the vote from last time, which is the issuance of a permanent operating license, and accepting the no bar to the fitness and competency. So your vote would be to accept that and move forward with the vote from last time. And that's, anybody have any questions on that? I guess that's an awfully long motion, the way I described it, but again, as yeah.
You make it into just make it into a straightforward motion.
Yeah. Let's go with the motion from the CON committee would be to reaffirm the issuance of a permanent operating license and accept the fitness and competency report from the Department of Health, and that is that there is no bar to that transfer.
Second the motion.
Any questions?
There are no questions from Dan Clayton from New York State EMS. I just, no questions. I just want to make sure that it's clear to everybody here that, and I know it was a unanimous vote and approval last time, and that's fine. That's great. But when I hear the word permanent rollover, it concerns me, because this is not a permanent rollover of a MuniCon that was established under 3008. This is a new certificate that's being issued to the town of Ashland. It's not a permanent rollover from a certificate. They do hold a certificate, but certificate was rolled over in 2005 or 2007. So I want to make sure that you're understanding this is a new certificate that will be issued to the town of Ashland, assuming that you approve again tonight, with both the town of Ashland on it as well as the contiguous town that was on the application that's escaping me right now.
Lexington, I believe.
Oh, there were two other towns?
Lexington and, I don't remember all.
Prattsville?
Yes. So to be clear, it's a completely new certificate being issued to the town, with the town of Ashland and the other two towns on that certificate. And we still have to determine with the town of Ashland what they want to do with their existing certificate. But that's a separate matter and we'll have to deal with them on that later. So I just wanted to be clear, it's not a beauty count rollover. Thank you for allowing me to speak.
And I mean, to that point, and we may have discussed it, or maybe we didn't discuss it enough. I guess as a friendly amendment to the motion that was there. Does anybody have any questions regarding what Dan said and why that is what it is? I probably stated it incorrectly in that it's a, how would you describe it? A new license with expanded territory.
Is it correct?
Okay.
I said that's fair enough.
Yep.
It's a new certificate that would be issued with territory that includes the town of Ashland, but also two other contiguous towns, Lexington and Prattsville.
Prattsville, yeah. Any questions? No? You've got the floor, Carol.
Okay, we're just gonna call the folks that we have signed in here. So PJ Keeler,
In favor.
Steve Meehan,
In favor.
Steve Neer,
In favor.
Tracy Weir,
In favor.
Alex Knowlton,
In favor.
Dr. McHugh,
In favor.
Dr. Daly,
In favor.
Steve Kroll,
In favor.
Anne Marie Cross,
In favor.
me in favor. Jim Stairs,
In favor.
Dale Lingenfelter,
In favor.
Alan Bell,
In favor.
Steve Retzloff,
In favor.
Maria Walker, in favor. Charles Welch,
In favor.
Otto Madsen,
In favor.
Adam Fink,
In favor.
Paul Segru,
In favor.
Jeremiah Rod. Where'd he go?
Oh, we may have lost him.
Oh, he was there.
He was.
And even changed his name. Okay, motion passes.
Sounds good. All right, the next one is an application was received deemed to be complete and fitness and competency was requested from the Department of Health and they replied back that there was a no bar to the transfer. This is Air Methods Corporation essentially did a reorganization as part of a Chapter 11 filing, and the transfer is to go from what existed pre-Chapter 11 to post-Chapter 11. So the motion from the CON committee is to accept the application as presented, and your vote would be to make the transfer associated with no bar to the fitness and competency of the applicant. Steve Retzlaff will second. Any questions on that motion? Excellent. Up to you again.
Okay. PJ Keeler,
In favor.
Steve Meehan,
In favor.
Steve Neer,
In favor.
Tracy Weir,
In favor.
Alex Knowlton,
In favor.
Dr. McHugh,
In favor.
Dr. Daly,
In favor.
Steve Kroll,
In favor.
Anne Marie Cross,
In favor.
Me. Jim Stairs,
In favor.
Dale Lingenfelter,
In favor.
Alan Bell,
In favor.
Steve Retzloff,
In favor.
Maria Walker. In favor. Charles Welch,
In favor.
Otto Madsen,
In favor.
Adam Fink,
In favor.
Paul Segura.
In favor.
Jeremiah's still not on there. Okay. Motion passes.
Sounds good. The third one was an application received regarding a transfer of operating authority from Altamont Rescue Squad to Rotterdam EMS. The CON committee met, determined that that application was complete. It was forwarded to the Department of Health for fitness and competency review. And they replied indicating that there was no bar to this transfer as it relates to the license of, not the license, as it relates to the operation of Altamont Rescue Squad as circulated, before the meeting, that it seems obvious that Altamont Rescue ceased operation. And as it relates to the public health law, that operation stopped within or in excess of 30 days ago. So we reached out to Terry Hannigan just to ask him if we should phrase our vote differently, and he came back with a recommendation. So what I'm going to read is Terry's recommendation for the official vote, which would be the forwarded motion from the CON committee. First, that the transferee is fit and competent. And secondly, that we're acknowledging that the application is being approved by the Remsco with the acknowledgement of the fact that the transferring agency has not been operating for a continuous period in excess of 30 days. So that's the forwarded motion. Somebody wants to second it? Steve Retzlaff? Any questions on that motion?
We know when the last time Altamont EMS submitted a PCR.
Late, excuse me, it would be late December 2023.
The date. December 31st is the date
Oh, that they stopped?
that the last PCR was submitted on December 31st.
Oh, okay. Sound good?
We understand there's two things we're deciding here. First is the certificate transferable because it's gone past the 30 days? And second of all, do we agree with the findings of fit and competency review? So we're gonna put those are into one motion, so just to be clear.
I would like to just speak on that also, to make it clear that Rotterdam EMS put in the application on the 24th of January. And the CO1 committee met about it on the 29th and approved it and sent it to the state. So all the activity did happen within the 30 days. It's just a matter of the fitness and competency coming back within 30 days. And so that all the activity did happen within the 30 days while Altamont still was active. They may have been out of business, but they were not out of business for 30 days. So it all happened within the time frame.
All right. PJ Keeler.
In favor.
Okay, Steve Meehan. Steve Neer.
In favor.
Tracy Weir.
In favor.
Alex Knowlton.
In favor.
Dr. McHugh.
I'm actually going to abstain as the medical director for Rotterdam.
Dr. Daly.
Very confused, but in favor.
Steve Kroll.
In favor.
Emery Cross.
In favor.
Jim Stairs.
In favor.
Dale Lingenfelter.
In favor.
Alan Bell,
In favor.
Steve Retzloff,
In favor.
Maria Walker. Dave. Charles Welch,
In favor.
Otto Manson,
Favor.
Adam Fink,
In favor.
Paul Segru. Jeremiah, are you back?
Yes, sorry, I got kicked off for a second there. In favor.
Okay. All right, motion passes.
Very good.
So now that we're done, all we did was we endorsed the fitness and competency and acknowledged that it was outside the 30-day window. We did not make any recommendation or decision, and that's not up to us to make. How that 30-day issue gets dealt with will be dealt with by the state, right? That's
No,
their decision, not ours.
no, not entirely. The state can pull a license after, if it exceeds inactivity for 30 days. I don't believe that's been done.
No, but I'm
No,
saying it's up.
no
it-
license can be transferred.
Right.
No certificate can be transferred unless approved by the regional council.
Right,
So we
but it's still
approve.
not our decision to transfer it. It's the state's decision to transfer it. We simply said that
You
we
say-
have acknowledged the fitness and competency. And that we acknowledged that it was outside the 30-day window, but we did not make any opinion on what that 30-day window meant.
The dean very
We-
clearly demonstrated that they had started the process well
Right.
within that 30-day window.
Understood. But that's not our, that's somebody, that's the decision of the people that will issue the certificate to act on Dean's argument. We didn't act on Dean's argument.
As a regional council, we said it's a transferable certificate.
That was my understanding too.
And under SAPA, I believe, because he had all his paperwork in, it would be covered, so.
Okay. Good, thanks for
The
clarifying.
question that none of us have asked, though, is what does this actually mean from an operational perspective? Because Altamont is dispatched from a 911 perspective, not by Altamont, but by the town of Gilderley.
Right.
So you now own a certificate or are in the process of acquiring a certificate for a territory where you will not be doing 911 service unless called upon by the town of Gilderley.
Checking.
Right.
Right.
More information? Yeah, okay.
Love some.
So, inquiring minds want to know. There is definitely a backlog of non-emergency ambulance availability. We see, we see hospital transports not getting done or being delayed, and we see that backs up into the emergency departments for borders. And then that also spills over into, non-emergency work out of the nursing homes to doctor's offices, miscellaneous, anything. All right, so there's a whole underserved population of non-emergency EMS work that is available. So Rotary EMS is going to look to work in that area. That would free up the other vendor that works in that area to do those types of calls in other areas, which they're already licensed in. So hopefully this will just add more non-emergency resources to already overstressed system. So the goal is to not compete with anybody, to collaborate and to make more resources available on a regular basis.
No one will still service that area from an emergency standpoint.
Absolutely. And so Rotary EMS would be another licensed ambulance service in that town, and they would probably put us in the pecking list of where they go for mutual aid, or, they go, but they have Gilliland, I don't know what it is, but just pulling off the top of my head, they'd probably go Gilliland, and they would go, Albany County. They may go to Mohawk next, they may go to Rotterdam next, but there's a fourth one that's available.
But you're available for mutual aid, you're available anyway.
Right.
What
It would be
what you're
mutual aid.
describing would be the returns from the hospitals
What I'm describing, yes, is
and the, runs to dialysis centers and things like that within the space.
that's the business that we're actually looking to go after.
Mhm.
However, we would also be available on, before they have to actually technically go to mutual aid. There is now another ambulance service that's licensed for that territory, that they can actually go to mutual aid.
See it preventing a colony ambulance from going out, covering a colony in Altamont. It doesn't change Albany County going to Altamont because they have a certificate for the area.
Right.
And it's the same as they would be calling you to Altamont because you're the closest unit to
Right.
there otherwise anyway.
So the reality is that you're gonna, best thing for the patient. So I mean, if Colleen's closer, probably should go. And
Except they're not a certificate holder. So the certificate holder will have to
but that can
decline.
be, you know, that can be addressed in the dispatch protocol.
I'm not sure it can.
You'd have to ask them on it first.
Yeah. Have to go through the 3 certificate holders first. Would have to go, Gilderland would have to not be able to do it. Then they would have to go through you, Albany County, Mohawk,
And then,
and then they would be able to send the town of Colony,
right.
who's already sitting to help out at, you know, Western Turnpike or something.
They'd have the right of refusal.
Yeah, the other certificate holders would have to have the right of refusal first.
Right.
Yeah. See that being confusing, but getting patients out of the hospital sounds good.
Yeah, for what it's worth, you know, part of our discussions on the CON committee side is, you know, it's probably been a decade or more since we've done and this is just from memory, a license transfer where someone had not been operating. It was more than likely Greene County, maybe CMT or Richards or something of that nature, but I'm not even 100% sure that they ceased operation completely. It may have been that they ceased part of their operation, so we were transferring a license, but that was just part of the discussion we had that got us to this
A little
point.
more than 10 years ago, that was.
Yeah, I know. I had a lot more hair back when we had that discussion. But the next slide.
What it does sound like, though, is unlike some of the other ones that have gone this way, where there has been a longer delay. You know, in this case, the process was started well within that 30 days, so the clock should technically have stopped when those motions were filed.
Yeah, as Carol mentioned. Sounds good. The other item on the agenda is a revision to the bylaws. So those were all circulated at our last meeting. I don't believe, I'll refer to Steve, that do we need a roll call vote to accept the bylaw change? We looked and we didn't see that we did. No.
It says majority of the members.
Yeah. All right. So if someone would like to make a motion to accept the changes that were sent out?
Well, so I had a suggested change to the changes. We had dropped under the meeting requirement from 3 to 2. The suggestion being that there had been discussion of dropping the number of meetings annually down to a lesser amount. When we made the number of meetings basically mirror the statute of as business requires, as often as business requires, giving us the flexibility to select the number of meetings we want to have a year. And if we choose to change it, we don't have to go through a bylaws change like we did before where we had it locked into the bylaws. My thought is maybe instead of having a number for the number of meetings you can miss, have a percentage of number of meetings you need to attend. So that way, regardless of the number of meetings we wind up having in a year, that percentage won't have to change either, and we won't have to change the bylaws every time we decide to change the number of meetings that we have, which is why we were trying to change the bylaws in the first place. Just a thought. That made any sense? I don't know. I haven't had my pizza yet and kind of hypoglycemic.
Makes sense. But can you change them now, or does that happen?
Well, that one part may have to go another meeting if we send out a typed revision on that, but we can approve the rest of it if we want, I think, or we can.
I would say
defer
change
to it.
everything all at once.
So
I wouldn't
to delay another meeting,
this week, you know. And
so we can
over
wait
next
another
month.
meeting, I suppose. It's my thought.
That certainly
That
makes a
makes
lot
sense.
more sense from an operational
Yeah, it does.
perspective.
All right.
All right.
So.
Well, unless someone has an
We'll-
opposition to
we'll
that,
fix
we'll
that and
table
then
it
we'll
and we'll resubmit with the change that
So
Carol
then
has
Tim should
mentioned.
Send them out again
Yeah.
Yes.
with an explanation of one additional change that changes this to this, and then everyone has a
Yep.
obligation to read it before next month.
Anybody object to that? Just trying to make it as clean as possible so we don't have to do this again for a while.
Sounds good. We have nothing under old business. Any items from the floor?
I won, just to let everybody know, as you probably know, that, Tim in the office was very helpful with a naloxone study that we did, looking at the difference between the 8 milligram intranasal formulation and the 4 milligram intranasal formulation, which we did with the state police. We substituted out 8 milligram doses in place of the 4 at the 3 troops that are closest to Albany, so G, K, and F. And then we looked to see whether or not there were any differences in outcomes for the patients. This was a little different than some of the studies that have been done with naloxone before, because anytime there was a fatality, we actually went and reviewed the body cam footage as well to see whether or not this was a patient who was indeed potentially salvageable or was long dead. Of the patients that were attended by troopers following a call for an overdose who received naloxone, 99% in both groups survived. So if somebody calls for help, recognizing an overdose, that's the thing that makes the difference in terms of outcomes. After that, when we went through all of the different elements that we were looking at, the only big difference between the 8 milligram and the 4 milligram formulation was ultimately that people who get the 8 milligram formulation have 2.5 times more likely to get severe withdrawal response rather than the ones who got the 4 milligram. Realize the 4 milligram folks, about 1.7% of them, of the people that got the 4 milligram, a significant portion of them got almost 2, right? Because that's exactly what it is. And with the 8 milligram, the exact same number of people got 2 doses of that. So there were no difference in terms of who got 8 milligrams because of 2 4s or who got 16 because of 2 8s. But that ultimately was published by the CDC in their MMWR in partnership with the Department of Health and the State Police. But that was done thanks to help from this office, which was really pretty cool. And I think will ultimately go a long way to making sure that we're taking good care of patients when we can and not making them miserable when we don't need to. So it was good science, very classic and simple, and good partnership with the Department of Health. So thank you. Thank you.
Great success rate.
Hmm?
Great success.
Great success. And that was one of the really interesting things, because if we go back, Jim, and we look at the other studies that we've done with naloxone and look at the nearly 16,000 cases of naloxone administered by police officers over the course of the last 10 years, it's about 86% survival. But what we never did was look at all of the fatalities to get a better understanding of whether or not those are potentially salvageable. And it looks like the ones that we can save, we are.
Excellent.
Which is important, really important. I will tell you the other thing that's extremely interesting to me as I watch the body cam footage. This is for you to take back to your agencies, is I see empathic, expedient care on the part of the law enforcement officers, nearly universally. I see EMS coming in as a, yeah, whatever, okay, I'm here, with a very lackadaisical attitude. Now, the crisis is past, right? If law enforcement has already reversed the overdose, but some of these cases where they were starting to work the cardiac arrest, right? That's still an expedient care. That's still a case that requires empathy. And I'm seeing a lot more empathy from the police officers than I am from the EMS providers. And I'd say that just to this group as a group of leaders, to remind your crews why we're doing the things we do, that empathy and goodwill go a long, long way when we're responding to people in crisis. So.
Excellent. Any other items from the floor? Our next meeting is April 22nd. Motion to adjourn.
I have a question regarding.
Oh, go ahead. Oh, yeah, I'm sorry. Is that,
No,
so I
this-
should look.
this- this- this-
You have, he has
Oh,
422, so I'm
you
just
have to
gonna,
have-
I'm just gonna
Tim-
look at
Tim
my
was being
calendar.
anticipatory.
Yes.
Yeah,
Yeah, really.
Me too.
Yeah, so it would
Sorry.
be March 25. March 25. All right, now we'll have a motion to adjourn.
I'll make the motion.
Motion by Alan, seconded by Steve Retzlaff. Anybody want to abstain or vote no? Thank you for your participation. See you next month.
Yeah, we had a bunch of discussion.